Psychoanalysis is referred to as a talking therapy. The psychodynamic approach assumes that a mental disorder is the result of unresolved conflict in the unconscious stemming from childhood trauma. So the therapy aims to provide the individual receiving treatment with insight into the repressed conflict that's producing their abnormal behaviour. It can be used to treat a range of disorders, including depression and anxiety disorders. In Freud's therapy, the therapist is referred to as the analyst. The therapist's role is to look out for clues that reveal unconscious thoughts and feelings and offer the individual an interpretation of the underlying meaning of their abnormal behaviour. There are a number of techniques that can be used to bring the unconscious into the conscious. Freud proposed that dreams were a way for us to vent our unconscious desires. In the therapy, the client describes a dream and the analyst offers an interpretation of the underlying meaning of the dream content. According to Freud, the individual will be unaware of the true meaning as the dream disguises the wishes being fulfilled. The analyst asks the client to say anything that comes into their mind or respond to a cue word without thinking about it first. The uncensored responses should reveal what the client really thinks and feels. The client is asked to talk about an ambiguous image such as an ink blot. Particular responses or themes used by the client can be used to uncover repressed thoughts and gain insight into the unconscious. Once insight has been gained into the underlying conflict and trauma, this can be worked through in order to resolve it and help the individual come to terms with the trauma and cope in the future. The patient or client can experience transference, where they project their unconscious feelings onto the therapist. The therapist should be sensitive to this and use it to work through the conflict remaining neutral. This treatment usually involves many sessions over a relatively long period of time. Psychoanalysis is an appropriate therapy for neurotic disorders such as anxiety disorders, and the insight gained by the individual undergoing the therapy has the potential to help them cope in the future. It's been shown to be an effective therapy which can successfully treat abnormal behaviour. For example, Bergin in 1971 reported a success rate of 83% for patients having psychoanalysis, compared with only 30% in control groups not receiving this treatment. Some researchers, however, argue that it is not effective. Isaac in 1952 reported figures that showed psychoanalysis to be ineffective, and he concluded that it did not work. However, Bergin used the same data but different criteria to measure success and showed that it does work in around 80% of cases. This suggests it may be difficult to assess the effectiveness of the therapy if success is a subjective concept. Psychoanalysis is often expensive and time-consuming, which might make it inappropriate for some people. It's also inappropriate for psychotic disorders such as schizophrenia, as these individuals lack any insight into their condition. It's difficult to determine whether the therapy works in the way it claims to. The analyst's interpretation of the source and nature of the conflict might not be accurate. It could be argued the individual feels better because they've talked about their problems and they've been listened to, rather than they've gained an accurate insight into their unconscious mind. Furthermore, there are ethical issues with the therapy. The analyst is in a position of power, and the patient or client is likely to be confronting difficult memories and feelings. The client is vulnerable and reliant on the analyst having their best interests at heart. Repressed memories recorded in therapy could be suggestions from the analyst rather than genuine memories, and so the trauma the individual experiences when they think they're remembering something unpleasant from their past may not be justified if these are false memories, and these memories could have negative implications for them and their families. Psychoanalysis is the best known psychodynamic therapy, but there are others. Play therapy, for example, is used with children who've experienced trauma. This can involve using dolls or puppets to role-play difficult situations and gain an insight into the child's experiences. Another therapy is psychodrama, which is a group therapy where one member of the group identifies an issue they want to resolve, and then the group are assigned relevant parts to play, and they improvise a role-play to help the individual gain insight. It's interesting to know about other therapies, but you can only be asked directly about psychoanalysis in your exam.